Are you aware of the sign where your stool turns black? Actually, with colon cancer, having black stool can sometimes be a sign of bleeding. According to data from 2015, colon cancer was the most common type of cancer among Japanese people. One possible reason for this is the westernization of the diet. There are also other factors. YouTube has videos titled Early Symptoms of Colon Cancer, but colon cancer actually has no early symptoms. By doing this, deaths from colon cancer can be reduced. There is data showing that the risk was reduced by 20%. Please listen until the end to find out what kind of symptoms appear if you have colon cancer. Good morning from YouTube Medical University. Today we'll discuss what you must avoid to detect colon cancer early. Lifestyle and eating habits that raise colon cancer risk. To detect colon cancer early, watch for the first symptoms that appear. I will also talk about the initial symptoms, and in the latter half actually when it comes to colon cancer, from the symptoms. It's a cancer that's difficult to detect early, so as a doctor who diagnoses colon cancer in outpatient clinics, I'd like to talk about which tests I recommend for early detection. In fact, according to data from 2015, colon cancer was the most common type of cancer among Japanese people, and especially for women. When you look at the types of cancer, colon cancer is the #1 cause of death, and the incidence rate of colon cancer has been increasing year by year. This is partly due to the westernization of our diet. Fast food and family restaurants have made meals more convenient and tastier. Colon cancer has been gradually increasing, however, please don't worry. If colon cancer is detected at stage 0 or stage 1, discovery leads to a 90% 5-year survival rate. It's a type of cancer with a survival rate above that. Listen until the end to learn colon cancer symptoms. Instead of worrying about early signs, most people just want to avoid cancer. Extensive research on colon cancer has revealed key risk factors. The key to cancer is focusing on pre-disease, reducing risks before illness to lower your chances of getting cancer. Lowering that risk is extremely important. Hospitals make money by treating illnesses, so they don't profit just because a disease was prevented. That's not the case. So knowledge about preventive medicine like this hasn't really spread to the general public yet. At YouTube Medical University, we responsibly and clearly share database methods for preventing diseases at the pre-illness stage. So please subscribe to our channel and stay updated with the latest information. And at the end of this video, I'll introduce 2 lifestyle and dietary habits that can help reduce your risk of cancer. Tobacco is widely known to raise cancer risk. However, whether quitting smoking actually reduces cancer risk for smokers is a different matter. Many behaviors raise cancer risk, but little data shows specific actions actually lower it. So, at the end of this video, I'll introduce 2 of the few lifestyle habits that can actually lower your cancer risk. So I'd be happy if you stick around to hear about those as well. Here's today's agenda. First, I'll briefly explain the colon's role. I'll now cover the 4 main initial symptoms of colon cancer that many of you may be concerned about. And third, I'll introduce 5 risk factors you should be aware of to help prevent colon cancer. And fourth, I'll introduce 1 important test for early detection, especially because colon cancer often has no symptoms. And fifth and finally, I'd like to introduce some lifestyle habits that, according to limited data, can help lower the risk of colon cancer. This will be a long video. This single video covers all the key points about colon cancer. I encourage you to watch it multiple times or take notes. Let's begin by reviewing the colon's role. The colon is the part of the digestive tract that's closest to the anus among all the pathways food passes through. The nutrients you take in through your mouth pass through the stomach and small intestine and eventually make their way to the colon. This thick tube is the colon, and it's said to be as long as 1.5 to 2 meters. That's surprisingly long, isn't it? What it does is absorb nutrients, and another important function is absorbing water. Nutrients are mainly absorbed in the small intestine, but water is not easily absorbed there. Food moving from the small to large intestine gradually loses water. The water decreases and the stool gradually forms into a solid mass. So at this stage, the stool is still soft, but by the time it reaches the end near the anus, it becomes hard. It's said that the large intestine can absorb up to 6 liters of water a day. That's an amazing ability, isn't it? Hospitals also use specialized terms, so I'll explain them. It's divided into the colon and the rectum. The rectum is near the anus and the colon is divided into 3 parts. The ascending colon moves upward, the transverse colon goes across, and the descending colon moves downward. The S-shaped curve between the colon and rectum is the sigmoid colon. All of these together are called the large intestine, so no matter where cancer develops in any of these parts, it's called colorectal cancer. Stool remains soft as it moves through the ascending colon, which is important when assessing early symptoms. Next, let's discuss how cancer develops and ways to detect colorectal cancer early. I'll discuss the initial symptoms and if the disease begins with them. Many YouTube videos claim to show early symptoms of colorectal cancer, but there are actually no early symptoms. This is clearly stated in the guidelines. So, what I'll talk about this time are the initial symptoms, colorectal. I'll explain what kind of symptoms occur when the cancer has grown to a certain size. I'll repeat myself, but even at the stage of initial symptoms, colorectal cancer can sometimes be treated with surgery or cured with chemotherapy, so please listen with hope. Early colorectal cancer symptoms include thinner stool as the first of 5 signs. Here is a colonoscopy image. Colorectal cancer causes the inside of the colon to swell and narrow the passageway. As a result, the path for stool becomes thinner, which makes the stool itself thinner. However, as I mentioned earlier, stool tends to become harder in the latter part of the colon. So, when cancer develops here, the stool itself is still soft and can pass through, and it forms a mass here, so the stool does not become thinner. A tumor in the lower colon can cause stool to become thinner. If you understand the colon's functions, you can predict symptoms. Be careful if your stool changes even once. Just because your stool is thin, I don't want you to worry that it's colon cancer. Everyone experiences changes in their stool, so if your stool is clearly thinner than before and it continues to get thinner and thinner over time, if that's the case, colon cancer is possible, so consider visiting a hospital. Early symptoms of colon cancer. The second one is constipation. I think you'll understand this well if you watch the previous videos. Cancer narrows the inside of the colon, right? So bowel movements get worse and you tend to become constipated. Another reason is that as colon cancer grows inside the colon, it makes it harder for the colon to move, which makes it more difficult to pass and expel stool. Those are some causes, and colon cancer can also cause inflammation. When this happens, our abdomen becomes sluggish and its movement slows. Constipation can also happen with colon cancer. Since constipation is a common symptom, it can be hard to treat. If your constipation keeps getting worse and worse, it might be a good idea to keep colon cancer in the back of your mind as a possibility. The third initial symptom of colon cancer is anemia. Colon cancer can cause anemia. For those of you wondering why, almost all cancers have a characteristic called neovascularization. Let's say this is the passageway for stool, and colon cancer starts growing rapidly. When that happens, cancer develops new blood vessels called neovascularization, and these blood vessels start growing rapidly inside the tumor. Our normal blood vessels are made by DNA and are constructed very precisely so they don't bleed easily. However, the blood vessels that form temporarily due to cancer are fragile, so when stool passes through or the colon moves, they are easily stimulated and tend to bleed. As a result, the slow bleeding from colon cancer can lead to anemia. And the troublesome thing about this anemia is that it continues slowly and persistently. Unlike hemorrhoids, which cause noticeable bleeding that turns the toilet bowl bright red, colon cancer bleeding is usually so slow and slight it's barely visible in your stool. When I was seeing patients in the outpatient clinic, a 70-year-old man came in and complained that he had recently been feeling short of breath. His face was very pale, so I suspected anemia. A blood test showed his hemoglobin was... Usually it's above 10, but his was just 4. Finding this odd, I decided to investigate further. As a result, colon cancer was found, so it was gradually progressing. Anemia. The important symptoms of anemia are fatigue, shortness of breath, and... Facial pallor, or a pale face, is another symptom. If you notice this, consider visiting a hospital. This is the fourth initial symptom of colorectal cancer. It's bloody stool. As I said, bleeding may result from colorectal cancer. And while this bleeding is often hard to notice, if the bleeding is coming from the latter part of the colon closer to the rectum, you may see bright red blood mixed in with your stool. Think about it when you see red blood mixed in your stool. Colon cancer is one possible illness, but hemorrhoids and other causes exist too. There is also something called diverticular bleeding, where a pouch forms in the colon and bleeding occurs from that area. And are you aware of the sign where your stool turns black? I think many people who are knowledgeable about health already know about this. Actually, with colon cancer, having black stool can be a sign of bleeding. Even when bleeding occurs from the colon, the blood can oxidize and turn black and then come out in your stool. Our blood is red if it comes out right away. However, if it remains in the body too long, it oxidizes and turns black, so remember that. To explain in more detail, when blood comes into contact with stomach digestive juices or stomach acid, the red blood turns black. So if your stool is black, of course there is a possibility of colon cancer, but there is an even more common cause. Black stool may result from stomach ulcers, gastritis, or esophageal bleeding. Regardless of cancer, black stool is a serious issue. If you notice it, I strongly advise going to the hospital immediately. Now then, next I will explain what kinds of risks there are for colon cancer. Here is the first risk factor for colon cancer: red meat and processed meat. Red meat refers to what we commonly call red meat, so it includes beef and pork. Chicken is considered white meat, so it is not included. Meat is a key protein source, rich in essential amino acids, vitamin B12 and other nutrients. However, data shows that processed meats from these types raise the risk of colon and other cancers. When it comes to red meat, it's also linked to stroke, breast cancer, and heart diseases like myocardial infarction. It's also said to increase the risk of prostate cancer. And processed meats, in addition to the risks I just mentioned, data also shows they increase your risk of pancreatic cancer and diabetes, but I'm not saying you should never eat them. That's not what I mean. I also eat meat regularly. What's important is not to take that data at face value. It's about knowing how many grams become dangerous and why they're dangerous. For example, with red meat, it's eating over 100 grams daily. In that case, the risk of colon cancer may increase. Processed meat consumption of 50 grams daily has been shown to raise colon cancer risk. As for the quality of the data, you can be almost certain that processed meat increases these risks. Speaking of Hamburg steaks at restaurants, since one serving is about 150 grams, 50 grams of processed meat is actually a small amount. On the other hand, if you stay below these amounts, there's no clear data showing that the risk increases. Don't just believe videos claiming red meat is bad and avoid it. There's plenty of information available. Because there's so much information out there, it's easy to pick up incorrect information. Let's remember why it's dangerous. Processed meat is risky due to additives and salt content. What's especially noteworthy is a preservative called nitrite. It's actually said that it may have a negative impact on the human body. These preservatives may cause inflammation, raising cancer risk. Risk rises and processed meats are high in salt, so excess salt is also a concern. Excess salt can cause high blood pressure, raising the risk of stroke and heart attack. Not all processed meats are bad. If they're low in preservatives and salt, they can be safe. There's always that possibility, so don't just believe everything. Try to understand why something is seen as bad, and I hope you can judge for yourself if something is healthy and if what someone says is true. At YouTube Medical University, we share this information, and I'd be glad if we could learn together. Lean red meat, not just processed meat, is considered risky because it can easily cause constipation. It's said that a type of bacteria called harmful mutant bacteria in the intestines can easily increase. In other words, it's believed that constipation or a disrupted gut microbiome can lead to an increased risk of colon cancer. Here is the second risk factor for colon cancer. It's a lack of exercise. When you don't get enough exercise, you're more likely to become constipated. As I mentioned earlier, constipation is one of the possible causes that can increase the risk of colon cancer. So if you don't get enough exercise, your bowel movements slow down, which can lead to constipation. It's said that this may increase the risk of colon cancer. The third risk factor for colon cancer is obesity. People with a body mass index of 25 or higher reportedly face a higher risk of colon cancer. Body mass index is found by dividing your weight by your height twice. For example, with a height of 160 cm and weight of 50 kg, divide 50 by 1.6, then divide that result by 1.6 again. A value over 25 indicates a risk of colon cancer. The fourth colon cancer risk factor is excessive drinking. What qualifies as excessive? For beer, it's a large bottle. Drinking a large beer, a serving of sake, or 2 glasses of wine daily is considered excessive. There is data showing that both men and women have an increased risk of colon cancer. According to one study, the risk of colon cancer increased by 1.4 times. Alcohol also impacts different areas of the digestive system. The risk of cancer along the digestive tract increases. This includes oral cancer, which is cancer inside the mouth, and pharyngeal cancer, which is cancer of the throat. Esophageal cancer is cancer of the esophagus and raises the risk of liver and colon cancers. Be especially careful if your face turns bright red when you drink alcohol. I won't go into details. This means you don't metabolize alcohol well, causing acetaldehyde to build up in your body. It's said that this especially increases your risk of esophageal cancer, so if your face turns red when you drink, please be extra careful. The fifth risk factor for colon cancer is smoking. Like alcohol, smoking also increases your risk of developing cancer. Simple. It contains carcinogens. Smoking raises the risk of cancers like lung, stomach, and colon cancer. And it can also decrease lung function, but on the other hand, there is also data showing that quitting smoking at any age can gradually improve lung function. So please consider reducing or quitting smoking no matter how old you are. It's never too late. Of course, if you really love smoking and it's one of your joys in life. If you feel living longer isn't worth giving up something you love, you don't have to quit. Talk openly with your primary doctor about your life and decide from there. Well then everyone, thank you for waiting. Since colon cancer usually lacks early symptoms, I'll discuss recommended screenings to help detect it sooner and boost 5-year survival rates. The important test for early detection of colon cancer is the fecal occult blood test. The fecal occult blood test involves collecting a stool sample with this kit and submitting it for examination. This test is usually done over 2 days, and even a small amount of blood makes the result positive. I heard this test can show positive results even before symptoms appear, and also if you have polyps. Isn't it not that effective for colorectal cancer then? I hear that a lot, but this fecal occult blood test is actually a very important test. To support that, one of the tests that can be done at public expense in Japan is this fecal occult blood test. Unlike pancreatic cancer screening, by having everyone undergo this test, the benefits outweigh the drawbacks. There are very few such tests. Those include stomach cancer screening, colon cancer screening, and breast cancer screening. Cancer screenings for things like pancreatic cancer, prostate cancer, or brain tumors are not tests that are publicly funded, meaning they are not covered by your city or town. Even when these tests detect something, it still ends up being cancer. It's because cancer is unlikely to be found, or the test's side effects may be worse. Data shows this fecal occult blood test lowers colon cancer death risk by 20%. This test is publicly funded, but only 40% of Japanese people take it. Why? Of those who test positive in this fecal occult blood test, 5 to 10% have colon cancer. About 50% have colon polyps, while others have blood from hemorrhoids. A positive fecal occult blood test can also occur for these reasons, and just because someone has colon cancer doesn't necessarily mean the fecal occult blood test will be positive. In cases of advanced cancer, about 80% of people, about 50% of early-stage cancer patients test positive for fecal occult blood. So even with a positive test, only about 5%, of people actually have cancer, and if having cancer doesn't always mean the test will be positive, then isn't this test kind of meaningless? That's what a lot of people think. It's true that 5% sounds low, but some data supports it. Among people who had a positive fecal occult blood test and then underwent a colonoscopy, half of those who were found to have colon cancer were at stage 1. Compared to when people had symptoms like anemia or thin stools and were then diagnosed with colon cancer after a colonoscopy, only 17% of those people were at stage 1. By the time symptoms show, colon cancer has often already advanced. A positive fecal occult blood test is crucial as it's considered the only early detection method for colon cancer. No doctor, I tested positive before, but since I have hemorrhoids, I thought it was fine and didn't get a colonoscopy. Some people do this, but actually less than 5% of those who think they have hemorrhoids test positive on a fecal occult blood test. So only about 5% actually have hemorrhoids. Fecal occult blood tests rarely turn positive due to hemorrhoids, so don't assume a positive result is caused by them. You may think it's fine to retake the test, but even if the new result is negative, the first result still matters. A positive result is not always caused by hemorrhoids, so even if you get a positive just once, I recommend that you definitely get a follow-up colonoscopy for further examination. And one more thing about polyps. Actually, the fecal occult blood test is also an important test for finding polyps. As for how this is related to colon cancer, actually, about 80% of colon cancers gradually develop from polyps. They grow and become cancer. To explain further, adenomas are a type of polyp. I mentioned that half of positive occult blood stool tests are due to polyps, and among those are adenomas. These adenomas can slowly grow and turn into colon cancer. This is called malignant transformation, and some become cancer. That's why, if your fecal occult blood test is positive, you should get a colonoscopy. By removing the polyps at this stage, we can prevent them from turning into cancer. For this reason as well, the fecal occult blood test is a very important test. I explained it in detail and at length, but it's hard to explain this much during a short outpatient visit, so the general public still doesn't really understand the fecal occult blood test. If you listened to today's talk and thought this is important, I hope you'll help reduce the number of people suffering from colon cancer in Japan. I would be happy if you could share this video or tell the people around you about its content. Now finally, let me introduce 2 lifestyle habits that can help reduce the risk of colon cancer, which you've been waiting for. For anyone wondering why there aren't 5 options, there are many risks, but only a few ways to reduce them. I'll share 2 data-backed habits to help lower risk. The first lifestyle habit to reduce the risk of colon cancer is dietary fiber. Most people know vegetables are healthy, but their dietary fiber is especially helpful. Insoluble fiber in particular may lower colon cancer risk. Insoluble means dietary fiber that doesn't dissolve in your stomach. To put it a bit crudely, I think you've probably noticed that sometimes dietary fiber from things like mushrooms comes out in your stool just as it went in. That's insoluble dietary fiber. Among dietary fibers, it's often the one that has a rough or gritty texture. Examples include eringi mushrooms, bamboo shoots, soybeans, spinach, and lettuce. Don't just think it's healthy, so I'll eat it. It's good for you because these dietary fibers help relieve constipation. Just like how mushrooms come out as they are, they move easily through your stomach, so even if you eat red meat, which I mentioned earlier as a cause of constipation, combining them with vegetables can help relieve constipation. As a result, it is suggested that the risk of colon cancer may be reduced. One theory is that constipation keeps cancer-causing substances in contact with the colon wall, possibly leading to colon cancer. It is thought that the longer these substances stay in contact with the colon wall, the higher the risk, so relieving constipation is important. There is data showing that insoluble dietary fiber reduces the risk of colon cancer, and I think that's a very reasonable explanation. Now, the second way to reduce the risk of colon cancer is exercise. Some of you might be surprised to hear that it's exercise. Incorporating it daily isn't easy, but even moderate intensity exercise is acceptable. So what is moderate intensity exercise? It's the kind of exercise where you get a little out of breath, but you can still hold a conversation. For example, jogging or brisk walking makes you a little out of breath, but you can still talk with your friends. The best exercise is when you can't sing or talk long, but can manage brief conversations. Let's consider why exercise is good for you. It helps you lose weight and relieves constipation. Earlier, I said that not exercising can cause constipation and raise colon cancer risk. As I said, by exercising, the movement of your intestines is stimulated. It is said that relieving constipation lowers the risk of colon cancer. In addition, exercising helps you lose weight. By doing so, people who are obese, actually insulin doesn't work as well for them. Insulin is actually the only hormone in our bodies that lowers blood sugar levels. People with low secretion or poor function of this have diabetes, right? What's getting attention now is that there is data suggesting that insulin may increase the risk of cancer. So by exercising and resolving obesity, the body's resistance to insulin improves and the amount of insulin secreted decreases. Because of this, it's said that the risk of cancer might be reduced. Of course. This is only a hypothesis. And what I want you to be careful about is that there are people with diabetes who are taking insulin injections, but regarding those injections, there is no data showing that insulin increases the risk of cancer, so please don't worry about that. How was it? This time, I introduced lifestyle habits that you should absolutely avoid because they increase the risk of colon cancer, as well as initial symptoms to watch out for. Colon cancer has no early symptoms, but it's still important to note initial signs. I mentioned your stool may get thinner, you could become constipated, have blood in your stool, or develop anemia. And I mentioned that the risks for colon cancer include red meat, processed meat, lack of exercise, smoking, drinking alcohol, and obesity. Of course, it's difficult to reduce all of these risks, but I suggest trying even one thing you feel you can handle. Early detection of colon cancer relies on the fecal occult blood test. You can get this cancer screening covered by your local government, so if you are over 40, please consider getting tested. And finally, to lower the risk of colon cancer, I recommend insoluble dietary fiber and moderate intensity exercise. Please try these things to stay healthy and live a long life. This was a long video, but thank you for watching until the end. From now on, I will continue to share useful health information in an easy to understand and responsible way backed by data. If you like this video, please give it a thumbs up. Subscribing so you don't miss the next video would make my efforts worthwhile. See you in the next video.